T-zones and all the in-betweens. This video is dedicated to you guys from this old auntie here. I cannot believe I'm out of my teens already, but I have been for more than a few decades, a decade. I don't know. Too much maths. Irrespective, let's get into it. Teenage is a crazy time for your skin. You know, I always say that when you make your skincare routine, it has nothing to do with your age. It's about your skin type and your skin needs. But with one exception, which would probably be teenage, because during teenage, I would say the majority of teenagers has a very similar skin type, which is typically oily or combination skin. And you're flooded with the consequences of that. Like you have a very oily T-zone, it's always super greasy here. You have blackheads, you have whiteheads, you have acne, you have breakouts, you have a lot of dandruff, you have sweaty, stinky armpits. I don't know, whoever said sweet 16 has not seen me at 16 and has not seen most of you guys at 16, because you know, this is probably the hardest time in your lives to deal with your skin, unless you're one of those lucky rare few exceptions. To start with, let's talk about the basics. What you basically need to do is cleanse, moisturize, and sunscreen, right? That's always what we talk about. If you have very oily skin or you have acne or blackheads, we will talk about the actives that you can use then. So let's get into it. Now, to start with, talking about cleansing. Now, when you need to cleanse your skin and your skin is oily, you don't need to keep cleansing your skin all throughout the day. So don't overstrip your skin. That is the number one rule when I talk to any teenager, you know. Their whole logic is, acha, I wash my face in the morning, then I get to work, I get to college and I wash my face again. And I come back home and I wash my face again. And then at night when I'm sleeping, I wash my face again. And still my skin is so oily. That's not how it works. The more you wash your face, the more you strip away its natural lipids, your skin is now pressurized to produce more natural lipids. So your skin is going to literally produce more oil and it's going to turn into a Bombay High. It's going to turn into a refinery. So calm down. You do not need to wash your face far too many times. Twice a day is enough. If you feel you've just come home from college or from school and you need to wash one more time, just wash with plain water. Don't overdo it, okay? Don't use a very harsh cleanser. After washing your face, your skin should not feel super stretched out and dry and you know what I'm talking about. You shouldn't get that feel. It should still feel soft. So don't overstrip your skin. If your skin is extremely oily, you have acne or blackheads or whiteheads, then use a salicylic acid based cleanser. That'll work well. If not, use a gentle, normal cleanser. Maybe a gentle cetyl alcohol based cleanser might be a little too much if you know your skin isn't too dry, but use a regular normal foaming face wash. That should be fine. If you have acne, then use a benzyl peroxide based cleanser. It works beautifully on acne. Honestly, at 2.5%, 5%, it doesn't matter. You're not keeping it for that long on your face, but it really helps reduce all of that bacterial activity on your skin that could be causing your acne. Just remember, with a benzyl peroxide based cleanser, it can bleach your towels. So be a little careful about that. Wash it off entirely. Use it in the shower. If you have truncal acne, like acne on your back or on your chest, you can apply it there as well. Keep it for a good 5 minutes and then wash it off. One more quick little hack is, if you have sweaty, smelly underarms, you can use this benzyl peroxide based cleanser in your underarms. Keep it for about 5 minutes and wash it off. It doesn't reduce the sweat production, but it reduces the odor producing bacteria. So the stinkiness will probably go down. One more thing you can consider is if your skin feels very dry after using your regular face wash, what you can do is use a face wash at the end of the day, okay? So you get all of that sunscreen off, the grime off, if you're wearing makeup off. And in the morning, you can use either a really mild cleanser or just water. So choose your cleansers, like I'm saying, based on how your skin feels, okay? Next, coming to your actives. Now, you guys are teenagers and you don't actually need far too many actives. I don't think you really need to start on retinoids this early. I normally recommend starting at post 25. So you don't really have to worry too much about the anti-aging aspect. Stick to your cleansers, moisturizers and sunscreens. But if your skin is extremely oily and you have blackheads or whiteheads developing or this extremely oily T-zone, you can consider using a niacinamide or salicylic acid works beautifully on reducing that oil production, calms your skin down, reduces the blackheads and the whiteheads, even acne to some extent. So these are actives that you definitely can use. You can use them either in the AM or the PM before you use your moisturizer and your sunscreen. You could also consider using retinoids if you have proper acne, but try not to use retinoids on your own. You need, firstly, if you have acne and you're using retinoids for acne, you're going to need prescription grade retinoids. Just retinol doesn't really work on acne. So if you're using it to treat your acne, talk to your dermat. These are very strong molecules, so don't experiment too much on your own. Whereas niacinamide and salicylic acid, these are generally OTC products, use lower percentages, 5 to 10% of niacinamide, 1 to 2% of salicylic acid, and you're good. So, these are things that you can use on your own. If you have a little bit of pigmentation, you can use kojic acid, you can use azelaic acid. Both of them work very well. Azelaic acid, in fact, works really well on even post-acne pigmentation. So these are actives that you can definitely use. Be careful though, if you're using exfoliants like AHAs, like a lactic or a glycolic acid, use it only 2 or 3 times a week. Don't use it every day. Don't overdo anything. The biggest funda when it comes to skincare is less is more. Whenever you use a product, use less. Except for sunscreens. You got to go crazy on your sunscreens. But everything else, do not overdo. It's very easy to strip your barrier, damage your barrier, and go overboard. Right? You don't have to fall prey to every trend, try every product out there. You really don't need to do that. Next, coming to hydration. Now, this is something I love talking to teenagers about because everybody with oily skin believes that my skin is already producing a lot of oil. Don't give me a moisturizer. If I moisturize my skin, it gets too oily. Not true. You're using the wrong moisturizers if it's getting too oily. What you need to do is use a really lightweight gel-based kind of moisturizer, which is non-comedogenic, so it doesn't worsen your acne. And use that regularly, once in the morning, once at night. It'll help you tolerate your actives better. It'll keep your skin hydrated. Oil and water are two completely different things. So yes, your skin is producing oil, but it could still be dehydrated and lacking water. So you need to hydrate, and that is non-negotiable. Next, coming to sunscreens. Now, again, I see a lot of people who come in and tell me that every time I use a sunscreen, it sort of clogs my pores and I break out more. Again, you're using the wrong sunscreen. So you get 10,000, 50,000 different types of sunscreens out there. And don't tell me not even one is going to suit you. That's not true. You need to find one that suits you. Usually look for a super lightweight, non-comedogenic sunscreen again. You can, if your skin is very oily, go for a matte finish sunscreen. So it sort of reduces that sheen and the shine on your nose and, on your T-zone. So go for a matte finish, silicone-based, non-comedogenic sunscreen, recommendations given here. Or you can go for a light gel-based or a light fluidy kind of sunscreen again. Recommendations given here. So if you want a tinted sunscreen, so you don't want to really wear makeup every day, but you just want a little tint in your sunscreen itself, you get beautiful tinted sunscreen options as well. Recommendations again mentioned here. Try them out. If you don't like one, try another category. Like if you don't like matte, there are people, I haven't found 2 people who really like the same sunscreen, honestly. So if you don't like matte, try the fluidy ones. If you don't like a tinted matte one, try a tinted gel-based one. So there's so many things that you can do in terms of sun protection. If you still feel that, hey, I want to reapply and it's making it too greasy, you can use sunscreen powders or a sunscreen compact. All of these things also really work, but preferably for reapplication. Sunscreen sticks is something that I'm not a very big fan of. Personally, because I feel, you're touching it to your face every time. So it's getting a little contaminated each time that you touch it to your face. Also, every time that you apply a sunscreen stick, you need 4 passes over each area to give it adequate protection, which just makes it really cumbersome. I think it's so much easier to just apply a regular sunscreen all over your face, right? Also, you can't really reach the areas very close to your eyes. So I'm not the biggest fan of sunscreen sticks, though I know a lot of people are. If it works for you, then fine. As long as you sun protect, that's very, very important. Next, coming to pimple patches. Now, I see a lot of teenagers nowadays going gaga about pimple patches, and I see people sporting it and walking around, and I feel quite happy that people are finally starting to do something about acne. It's very important to treat your acne early. I see a lot of parents typically tell their kids that It's just acne. It's like a teenage issue. As soon as you grow up a little bit, it's going to go away. So don't obsess over it. Don't bother putting anything on your face. Don't put creams on your face. Honestly, yes, it may firstly go away. But even if it does go away, it has a very strong chance of leaving scars on your face. And scars are very, very hard to treat. I'm talking about those pits and the depressions in your skin surface, the khaddas. Those khaddas don't go away with just creams. You need lasers, you need resurfacing, and it's just way more cumbersome to do that rather than just treat your acne on time. And it doesn't really cost a lot, it doesn't take much. So treat your acne. Sorry for rambling. I'm going to get back to my pimple patches. So yes, pimple patches work very well as spot treatment for single large acne. So use the hydrocolloid patches. I don't really recommend the salicylic acid patches because sometimes under occlusion, salicylic acid can really irritate your skin in that area, and you would end up with bad post-inflammatory pigmentation in that area. So use hydrocolloid patches. They just sort of osmotically shrink your acne. So a pimple that would have lasted maybe 3 or 4 days would go away in 1 or 2 days. So that really works well. But don't rely on only pimple patches to treat your acne. If you're getting them regularly, then you need some regular skincare, so talk to your dermat. Next, coming to a couple of things that I really want to bring up that I see a lot of young people nowadays doing is, for example, collagen sheet masks. Does not work. You cannot absorb collagen like this. It's like saying मैंने chicken मेरे मुंह पे लगाया and chicken का collagen absorb हुआ. It's not that easy, and I'm glad it's not, right? Like, I'm glad we're not just absorbing things, everything that we come in contact with. Collagen is a protein and it's not going to get absorbed. The only thing that these sheet masks do is help your skin hydrate, which is fine. It's great. But remember that that's what they're doing. You don't need to pay extra for that collagen. Any hydrating sheet mask is going to hydrate your skin. And that's it. And that too temporarily. So I'm not a big fan of these sheet masks. So I just saw the series called Call Me Bae, and I kept watching her apply a jade roller on her skin. And darling, it doesn't work that way. It's not doing anything for your skin. If anything, it's contaminated because you're not washing it probably. And then you're reapplying it on your skin and it's, just helping your skin breed more bacteria. The only thing it does do is it helps with lymphatic drainage. So if you have a lot of puffiness on your skin, yes, it's going to help you because there is a little bit of a massage involved in it. But other than that, it's really not doing much. Sorry. Next is toothpaste on acne, one of my favorite topics. If you followed my page long enough, you know that toothpaste on acne doesn't work anymore because earlier toothpaste used to contain something called triclosan, which was antibacterial, but that is now banned from toothpaste because it was a hormone dysregulator. So toothpaste now do not have triclosan. It does not have any anti-acne ingredient. So it's not going to work on your acne. So don't use toothpaste on your skin. It is going to irritate your skin, cause inflammation. It's not good for you. Lastly, a question that a lot of teenagers ask me again is makeup. They all want to use makeup and it's fine to use makeup. Makeup is not going to worsen your acne if you do it the right way. So for one thing, whatever brushes that you use, the sponges that you use need to be washed every single time. I wouldn't even say once a week. I would literally say every single time, particularly if you're prone to acne. If not, at least twice a week. Make sure you're washing it. That cleanliness is very, very important. The sponges need to be thrown away once in 3 months and the brushes need to be thrown away once a year, even if you're washing it, right? I've seen a video in which somebody cut a makeup sponge that they were using, and inside the sponge there was fungal growth. There was actually green fungus on the inside of that sponge, and from the outside you can't tell at all. So please be careful what you're using on your face. Secondly, do not experiment too much with these makeup products. Don't try out these very random brands with random glittery, shimmery packaging. They may not necessarily be good. Look for traditional trusted brands. Stick to those, particularly if you're acne prone. Clinique typically works pretty well for my acne prone patients. This is not an ad, but yeah, I think usually it works pretty well. The last thing is take your makeup off before you sleep. That's very important. Double cleanse, use a micellar water or a cleansing balm, or at least if you do that, of course, it's better, but at least bare minimum, wash your face. Please take your makeup off. Very, very important. And the next morning, before you put on your makeup, do your skincare first. So your moisturizer, your sunscreen has to go first. You can use a silicone based sunscreen which also works as a primer, right? So then you don't need to prime your skin before you do your makeup. So your sunscreen will work as your primer and then you apply your makeup. Reapply your sunscreen even when you're wearing makeup. You can use a sunscreen compact, sunscreen powder, like a lotion based or a serum based sunscreens also really work well for reapplication of makeup. That's it. If you have any more questions, please ask me in the comments. I will be very happy to help you. And please do subscribe to our page. It would make my day. See you.